Hey guys, now the last portion to the whole warm-up and spinal correction process is your weighting and the vibe plates. We see some really crazy things on the vibe plate, and we truly understand it's not really normal. You don't see it anywhere else. But vibration therapy and vibration exercise is becoming very, very popular, but it only gives you results when you do it the right way. So the first thing I see over here, Dr. Tim doing is the head weights. They're way too high, okay? The whole head weight system is designed to re-engage the muscles properly to help that lordosis, so the curve in the neck, come back, reduce that forward head posture so you're not forward like this, and this is only gonna cause you to do this, okay? That's not what we want, all right? So what you want to do is you go right over your eyebrows. You should be looking straight ahead. You should almost be able to see the bottom of the head weight with your peripheral vision, okay? The next thing is with these handles, so these ones have a variable vibration. You got to find your number. If you don't know how to find your number, you just want to, you can ask someone to do that, but Dr. Tim, how do you find the number?
So normally what we do is we'll have somebody just touch them right here on the sternal notch, and when you can start to feel a good steady vibration here, that's a good number.
Okay.
For about 99% of people, it's somewhere between 50 and 60. Okay. You know, it's not going to vary that much, but that's the way that we were taught initially on how to find the right frequency for that.
Okay. And the second thing that we see people, because the writing reflex is the most powerful reflex in a spinal correction, and after you've had an amazing adjustment, a corrective adjustment, is we want to engage that, because that's really where the correction and the nerve system and the brain actually become connected, and this amazing power that God put inside of you is flowing at 100%. So we don't want you holding on to the handles, okay? This totally disengages the writing reflex. We don't want you looking down at the ground. We want you looking straight ahead, as far as you can away. And then the other thing is we want you to be moving. So don't just stand there. And then the last thing we have is we have these timers for you. It's not for us, it's for you. You hit go or start. It should be 5 to 8 minutes. And then you let it go and you stay on it for the whole time. Anything less than 5 minutes is not going to do you any good. Anything over 8 minutes, it's not going to give you any more benefits. So stick to that 5 to 8 minute range so that you get the best results. Now the last thing we see is some of you have to do this CTU exercise at home as well. Now what we see people doing is they're just doing everything that we just tried to undo, okay? That's not how we do this. You don't want that force coming down to undo the curve in the neck. So some of you need to do it down. So this is down. You should tuck your chin and pull your head back, okay? Don't look up. Try and tuck your chin and go back. The next position is straight ahead of you. On your rehab sheet, it should show you what you need to do. If you don't have your rehab sheet, just ask one of us, and we can look at your x-rays and tell you which way to do it. All right.
All right, and then the last thing, guys, is after you feel comfortable on this one, the vibration back here is a little bit more intense. But it's a preset frequency, so you just flip the switch and you're good to go. But it's okay to leave these, okay? The handles are here for the sole purpose of some of our patients really have equilibrium problems. They come into us with vertigo type symptoms, and when they're standing on this vibration, that's really stimulating to them, and sometimes they need to hold on. So if that's you at the beginning and you need to hold on so that you feel like you're not going to fall down, that's obviously not what we're looking for. But the whole goal is, like Dr. Kevin said, is we want you to progress. So if I have to start here looking straight forward, then that's okay. But I need to work towards being able to start moving and marching and walking on there without using the handle. Okay, once I'm comfortable there, I can take the next step. I can come back here. Okay, no handle, you don't have that security blanket anymore, but we're getting a little bit stronger vibration out of these vibe platforms here. Okay.
And then the last thing that we see is when people are using this one, they're looking straight at the wall. This is not using your writing reflex. You have to look as far away as possible. So we want you to turn around. You can get your bearings. You can hold on to this, turn it on, get your bearings, and then turn around, and then start marching in place, moving your arms, your whole spine. Okay, the more accentuated it is, the more stimulation through your spine and up into your brain. We want your brain to progress. We want your cerebellum to continue to get better and remember these new positions, because when we take your next x-ray, we want to see progress and change, and it's only going to be doing it, and you only get that when you do it the right way. So we love you guys. Hopefully you understand, all your questions are answered. Now you know how to do it. You're an expert at spinal corrective rehab, and now you can teach others if you see them doing it the wrong way. We love you guys.